This lecture is titled Dental Caries and corresponds with the course DA 140A, Integrated Basic Science. At the end of this lecture, you should be able to name the most common chronic disease in children, identify dental caries as an infectious disease, explain the process of dental caries, identify the risk factors for dental caries, explain the risk factors and consequences for early childhood caries, describe the purpose of Canberra, explain the purpose of caries activity tests, use the caries risk assessment form to determine caries risk, describe the types of caries detection devices, describe the method of transmission of dental caries, describe the method of controlling dental caries, identify the infective agent in the caries process, explain the role of saliva in oral health, describe the relationship between diet and dental caries, and explain the demineralization and remineralization process. So what are dental caries? Caries is another word for tooth decay. It is an infectious, communicable disease, and it can affect individuals of all ages. It is the most common chronic disease in children. Cariology is the study of the cause of caries, the process of occurrence, and the science and practice behind management and prevention of caries. Caries are a transmissible bacterial infection. There are two specific groups of bacteria that are responsible for dental caries: Streptococcus mutans and Lactobacilli. Streptococcus mutans is abbreviated MS, and it is found in large numbers in dental plaque, and this is the main bacteria that is responsible for dental caries. Lactobacilli is abbreviated LB, and these bacteria are in the mouths of individuals with very high sugar intake. How do we get this bacteria? Infants are not born with this bacteria in their mouth, but is introduced very early. It is usually introduced between the mother and baby in the first few years of life, either by kissing, by feeding, or some other method of the mother's saliva coming into contact with the baby. Plaque is a colorless, soft, sticky coating that adheres to the tooth. A pellicle is a thin film coating of salivary material that is deposited on tooth surfaces. MS and LB live in colonies and multiply within this dental plaque. Plaque cannot be removed by rinsing the mouth or moving the tongue along these coated surfaces. Plaque must be brushed or flossed off of the teeth. Plaque can be removed at home and is not what is removed at a dental cleaning. Let's review the structure of the enamel surface. It is stronger than bone. It is highly mineralized. Hydroxyapatite crystals are arranged in layers or rods called prisms, and carbonated apatite in the enamel makes the tooth easier to dissolve. Let's discuss the caries process, or how caries form. 3 factors must be present to cause caries: a susceptible tooth, and most teeth are susceptible, it just means that you have a tooth; a diet rich in fermentable carbohydrates, which is not just candy, it includes fruit, starchy bread, potatoes, rice, and pasta. So this is really the diet of most Americans, and honestly, most people in the world. And you also need to have those specific bacteria, the Strep mutans and the Lactobacilli. Acid is a byproduct of the bacteria that live in the mouth. So when you have sugar plus bacteria, it equals acid, because the sugar is what feeds the bacteria and their byproduct is acid. That acid, combined with a healthy tooth, leads to tooth decay. Every time you eat, you're feeding the bacteria in your mouth. Acid production stays high for approximately 20 minutes when you're done eating or drinking something. If the episode is short, saliva can buffer the acid and protect the teeth. But if the episode is long, then that's when tooth decay is more likely to happen. A good example of this is when we tell patients, when we see patients with tooth decay, what we usually tell them is that if they're going to have something like soda, you want to drink it all in one sitting. Just drink it and get it over with. Don't sip on it throughout the day because that constant bathing of your teeth in that food for the bacteria leads to constant production of acid, and your saliva does not have the chance to buffer the acid and protect the teeth. So let's dive deeper into the process of tooth decay. There's a couple of terms here that we need to know about: demineralization and remineralization. Demineralization is when calcium and phosphate dissolve the hydroxyapatite crystals in the enamel. Remineralization is when calcium and phosphate are redeposited into those previously demineralized areas. This process can occur with or without the loss of tooth structure. This is a process that happens in everyone's mouth, and it happens quite frequently. So you will have demineralization happening all the time, but your saliva is able to rebuffer or remineralize that acid, and so calcium and phosphate are redeposited into those areas, which means that a cavity does not form. First, the tooth is attacked by the acids in the plaque and saliva. Then calcium and phosphate are dissolved from the enamel in the process of demineralization. Next, fluoride, phosphate, and calcium re-enter the enamel in that process called remineralization. This is an ongoing process of alternating periods of demineralization and remineralization. What happens is we have a few different things that can lead to caries. First, we have disease indicators such as white spot lesions, restorations, enamel lesions, and cavities that are in the dentin. There are risk factors: having too much of the bad bacteria, an absence of saliva, so dry mouth, or poor dietary habits, so overabundance of sugary or carb-laden foods and drinks such as sodas and chips. Then we have protective factors, so saliva and sealants, antibacterials, fluoride, and an effective diet. So it's all about creating this balance between risk factors, disease indicators, and then those protective factors. Let's take a look now at the stages of development of caries. We start with what are called incipient caries. You can also call these like baby cavities. So these occur when demineralization is first beginning. They usually appear as a small white spot on the enamel. There are other white spots that can appear on enamel. So just because there's a white spot does not mean that it is an incipient cavity, but it could be. So this is something that a dentist would have to look at. But just know that they can appear as a white spot on the enamel. They may also appear on a radiograph as a dark shadow, though that dark shadow has not penetrated through the entire outer enamel layer. As you can see here in this photo, the circled area, you can see these small dark gray triangles in between the teeth. Those are incipient cavities, and they have not penetrated the full layer of enamel yet. If an incipient cavity is not remineralized, the next step in the stage of development is cavitation. This is also known as an overt lesion or frank lesion, and this is the development of a cavity or a hole in the tooth. If the cavitation stage is not repaired with a filling, rampant decay is the next stage. This is the rapid development of cavitation that involves multiple teeth throughout the mouth. This typically occurs with kids that have what we call baby bottle decay, where a lot of the teeth are affected because they're not getting adequate home care and there's a constant intake of milk or formula. And then this also happens when people are have heavy drug use and they're not taking care of themselves and their diet is poor. It can also happen in elderly individuals if they're taking medications that cause their salivary flow to go down. And typically older adults are less mobile and they are less able to take proper care of their mouth as well. There are four general areas where caries can occur. The first are the pits and fissures of the tooth. These are primarily on occlusal surfaces, and they can also be on the buccal and lingual grooves of posterior teeth and in lingual pits of maxillary incisors. You can see these kind of stained areas on the chewing surface or occlusal surface of these molars. Those are pits and fissures. Caries can also occur on smooth surfaces. These are enamel surfaces such as the mesial, distal, facial, and lingual. Caries can occur on root surfaces. These are found on the roots of teeth where recession has left the root surfaces exposed. So in the photo on the top, you can see that the gums have what we call receded. So the gums have kind of gone away a little bit, and that exposes the root of the tooth. And we can get caries on that root surface, which is not covered with enamel. This is common in older patients with reduced salivary flow, which is known as xerostomia. This is typically due to medications or patients with a history of radiation to the head or neck. Recurrent decay means that decay is happening around an existing filling or an existing restoration. This can also be known as secondary decay. In the top photo, you can see that there's a small cavity starting at the edge of a gold crown. On the x-ray below, you can see that this patient has a few amalgam or silver restorations in their mouth, and there's a small cavity starting underneath of one. Early childhood caries, abbreviated ECC, is the most prevalent disease in children, and the sad thing is that it really can be prevented. Risk factors for early childhood caries are low-income families, limited access to dental care, no fluoride in the water, children with special needs, and particular ethnic groups. Early childhood caries can cause a huge impact on children. They deal with constant pain, missed school days, infections of their teeth and gums, inability of them to sleep, and inability to concentrate due to the pain. Baby bottle tooth decay is another term for early childhood caries. This occurs when there is rampant decay when a baby sleeps with a bottle of anything besides water. So it could be milk, formula, juice, anything besides water puts them at a risk for early childhood caries. When a patient comes into a dental office, we want to determine their risk for caries. This is called their risk determination. CAMBRA stands for Caries Management by Risk Assessment and is a way that we can assess their risk for caries. The goal of this is to assess the risk in an individual and create a preventable plan developed based on the patient's risk. Other ways that we can assess a person's risk for caries would be through a saliva flow rate test, which measures the amount of saliva in the mouth. In this test, a patient will chew paraffin wax for 3 to 5 minutes and then spit into a cup. The amount of saliva is measured. The normal rate of saliva flow is 1 milliliter per minute. Another way we can determine risk is through a caries risk test, or a CRT. This detects the number of bacteria in the saliva. A sample of the saliva from a patient is collected and placed into a vial to be incubated. Now let's look at how we actually detect caries in a patient's mouth. During a dental exam, we assess caries a number of ways. We use visual techniques, we use an explorer, and we also review radiographs. Visually, we are looking for dark stained grooves or gray shadowing underneath the enamel, which would indicate caries. We use an explorer to feel the tooth surface for a stick that indicates caries. And we'll look at radiographs to evaluate for interproximal decay, which can't be visually assessed in the mouth. We also have some more high-tech things we can use to detect caries. There are indicator dyes, which are used during a procedure, and any areas that are dyed or pick up the color are areas where decay remains because the decay absorbs the dye. Caries detection devices or lasers use a wand that's placed on the tooth, and a number, a sound, or a light is emitted through the device, indicating the presence of caries. Typically, the way that these machines work is that they're assessing the composition of the enamel and how dense it is. Saliva is very important for protecting your teeth. It offers physical protection by cleansing and diluting acid from the plaque. The thinner, the better. It offers chemical protection. Calcium, phosphate, and fluoride are there to remineralize the teeth. Bicarbonate, phosphate, and small proteins that buffer and neutralize the acids. And it also offers antibacterial protection. The immunoglobulins fight against the bacteria. We can prevent tooth decay by assessing our diet, limiting high sugar snacks and fermentable carbohydrates. We need to make sure to remove plaque, so daily brushing and flossing, especially after sugary or sticky snacks, and having regular dental visits. We can use fluoride to prevent tooth decay. There are over-the-counter methods, which are in toothpastes or rinses. We can also use prescription strength fluoride for high-risk individuals, and these may include in-office treatments as well as prescription toothpastes and rinses. There are antibacterial mouth rinses, such as chlorhexidine, which is used to reduce bacteria, and that is typically a prescription. We can increase or stimulate saliva flow. The use of sugar-free gum or mints with xylitol in them can help stimulate the flow, and xylitol is an anti-cariogenic ingredient. We can also use dental sealants, which are placed in the deep pits and fissures. These can reduce decay by up to 50%. Let's summarize some of the key points from this lecture. Dental caries is an infectious and communicable disease. It is a worldwide health concern affecting humans of all ages. Dental caries is the single most common chronic disease in children. Due to recession of the gingival tissues, many older adults experience root caries. Cariology is the science of the study of dental caries and includes causes, the process by which they occur, and the science and practice of caries management and prevention.